Okay, Fanny, you can start now.
Okay, thank you. Hello, welcome, and thank you for joining us today for the meeting of New York City Health and Hospital Capital Committee. Today's meeting is officially called to order. I would like to propose a motion to adopt the minutes of the Capital Committee meeting held in July 26, 2021. So,
Second. Oh,
thank you. Any second?
second.
Thank you. So I'm going to poll each one of the members of the committee for the vote. Jose Pagan,
Yes.
Dr. Katz,
Yes.
Frida Wang,
Yes.
Sally Hernandez Pinheiro.
Yes.
I don't know if Mr. Nolan is here, Bob Nolan.
No, he's not.
Okay, so that should be fine. Okay, so now I think now we have the now the resolution passed. Thank you, and we have now Ms. Flaherty with your report.
Good afternoon. Thank you for your time today. Yesterday, our office joined forces with Harlem Hospital in participating in the American Cancer Society Making Strides Against Breast Cancer Walk in Central Park. We look forward to working with Ms. Carol Robinson Edison at Harlem to grow our team collectively for a bigger event next year. OFD continues to work to initiate funded projects across our system in collaboration with our facilities and support identified needs for further advocacy. I want to thank the Capital Committee and multiple members of the board for participating in our education session on real estate and capital delivery last month. And we're looking at our prioritization and selection of capital projects as discussed and requested. Under separate cover, we'll be sharing the breakdown between our strategic clinical projects and our infrastructure, life safety, regulatory, and decarbonization energy projects. These three pillars are all important to ensure our environment of care for our patients, staff, and the community remain in the best condition as possible. For the status of our bond portfolio, we have 1 project in construction, 12 in procurement, 22 in design, and 2 projects left going through the design process. Based upon timing, 1 project was redirected to city capital funding, and we're carefully watching the supply chain issue to determine if certain projects require some adjustments to their schedules based upon potential materials shortages. We are also watching the market, and I don't think we are seeing the same competitive pricing that we had enjoyed during the height of the pandemic. So numbers are coming back to kind of the normal bidding labor, the bidding towards engineers' estimate. We are working closely with supply chain. We've received proposals for both our project management information system and facility management information systems. And we're embarking upon the evaluation process, which will really allow us the opportunity to secure a system of record like our own Epic for facility development. Our facility management team successfully supported our 2 recent Joint Commission visits this past month at Kings and Coney Island last week, and we're looking forward to supporting our colleagues at Lincoln Hospital this coming month. Our Housing for Health team is participating in the citywide initiative to permanently house individuals and families who are homeless and at risk of homelessness. The U.S. Department of Housing and Urban Development has awarded a limited number of emergency housing vouchers to New York City Housing Authority, New York City Housing Preservation and Development, and a rental subsidy voucher offers that ability for low-income New Yorkers to be permanently housed. Our team is working with ambulatory care, community care, and MetroPlus to identify eligible patients. Housing for Health is overseeing all program operations to assure that patients are supported throughout their application and housing search process. We are also working collaboratively to make sure our patients have continuity of care after they are permanently housed. The team is also feverishly working with HRA, ambulatory care, and MetroPlus to prioritize eligible patients for the 75 supportive housing units at the T building at Queens Hospital campus. This is a wonderful adaptive reuse of the historically significant former tuberculosis hospital. The entire mixed income 200 unit building will be ready for new residents in November, and we're looking forward to a ribbon cutting. So this is incredibly
Yay.
exciting. We walked the building while it was still in construction with our new CEO, Neil, and he was also very excited. It's quite a beautiful building and really a great example of what can be done to really readapt a historic structure. So it's also very complicated because it's under SHPO. It really has a lot of historic features to the building. And so we look forward to the ribbon cutting and seeing members of the board potentially join us. I don't have a date that will tie to a TCO, which is definitely not in our purview, but I did want to flag that exciting project. And with that, we're ready to take any questions and to present our one resolution for real estate.
I just wanted to follow up. You said you wanted a system like Epic to track the construction projects. Is that, I didn't.
Well, I was just comparing, we need a system of record for
Right.
capital project management as
Right.
well as our work orders across all our buildings.
Uh-huh.
So it's similar to we need a
Yeah.
system of record like we've successfully done for Epic for our patients.
Right, so are you RFP for, yes, so you're
Yes.
moving forward with that?
Yes, both RFPs went out. We've received proposals. So now we'll be in the evaluation phase, working closely with our colleagues in EITS, finance, and all of the facility representatives to make sure we hire the best and most appropriate firms
So
to
that
help
would
us.
take, you think, how long from like where you are now to where you'll actually have a system that you can use?
I think it will depend. I'm thinking it's going to be next calendar year.
Yes,
But I'd like to make sure that we fully vetted the options and look at the implementation and make sure that we're also getting the engagement and in the implementation process.
right,
So I would say sometime in the next calendar year.
okay, thank you, Christine.
Thank you.
Any other questions? Any other questions?
Oh,
No?
thank you so much.
Thank you, Ms. Larty. Now I think we have one resolution to consider.
Yes, this resolution is requesting authorizing the New York City Health and Hospitals Corporation, the system, to execute a revocable 5-year license agreement with New Time Dialysis, Inc. of New York, the licensee for its continued use and occupancy of 6,006 square feet of space to operate a renal dialysis center at NYC Health and Hospitals Elmhurst, the facility, at an occupancy fee rate of $71 per square foot or $426,426 per year, to be escalated by 2.75% per year for a total of $2,252,666.58 over the 5-year term. I'm joined today by our CEO, Helen Artiega from Elmhurst Hospital, to tee up this important resolution for Elmhurst.
Good afternoon, everybody. So we have a short PowerPoint for you and just giving you some background on New Time Dialysis Center. It's based in Queens, New York. It's been licensed to operate outpatient renal dialysis center at Elmhurst Hospital since 2002. This will be its 3rd renewal. Currently, right now, they're open 6 days a week from 5 in the morning to 11 p.m. to 11:30 p.m. New Time is also it's affiliated, operated with numerous dialysis centers around New York City, especially in the areas of Queens. And it's also currently under contract within the system to provide inpatient dialysis with New York City Health and Hospital Henry J. Carter. It operates currently right now in Elmhurst about 25 hemodialysis stations in which the treatments are provided to our outpatient and sometimes in urgent cases when we're in our overflow at Elmhurst inpatient as well. New Time provides instructions to our patients, which is given to them daily. They are also multi-language as well, and they operate on the 7th floor at Elmhurst Hospital. And currently, they just they have about 50 employees in that current space. I'm gonna go over this, and Christine will go over all the math.
So as mentioned by Helen, this is the 3rd time of the renewal. And what you'll see here is the cost per square foot of the space that's licensed for this agreement. And so there has been incremental increases throughout this agreement based on their occupancy since 2002, with the final year being at $69.11 per square foot. The volume of Newtown, it includes about 220 per month. It was reduced slightly during the pandemic. However, I believe it's
Yeah,
getting
they're back.
busier again. Do you want to talk a little bit about their work with insurers?
So
and
one of the things we really do appreciate with this partnership that we do have with Newtown Dialysis is that Dr. Bott is very integrated into our hospital. Anytime we have an emergency, he's always willing to help us, but more importantly, he also believes in our mission. And one of the things that he does do is he does have a sliding fee scale with us. And if a patient, like for example, if a patient is homeless and he's dialysis patients, he will reduce the sliding fee scale down to 0. So that's one of the things that makes our partnership really good. And he's also very he's always this. I can pick up the phone and say we have a special case, and he's always willing to lend a hand.
So next is an overview of dialysis across the system. So currently H&H is the organization. In some locations, we do provide our own outpatient dialysis, and then in other locations, as indicated here, we have partners that help provide those services for our patients. We have both Newtown as well as Dialyze Direct at Kohler and McKinney, and we also have another provider, River Renal Dialysis at Bellevue. So it gives you a sense of, it's definitely a heterogeneous mix of different models of provision of these important services across our health system. So from a license agreement perspective, Newtown would look to continue to occupy the space that they're in on the D wing of the main hospital at a rate of $71 per foot. And that rate is looking to be at a 2.75 increase from the prior agreement. And that would be a continuation of occurring every year for the next 5 years, showing you the total occupancy of the $2.2 million approximately. This was determined to be the fair market value as attached in the package. Elmhurst will continue to provide ancillary services, including hot and cold water, electricity, heating, air conditioning, security, and maintenance to this space, as well as some light housekeeping, given the co-location and institutional nature of it being embedded within the hospital tower. Next slide. And then this concludes our summary presentation. This is the resolution which I read previously as we were working to get this up. So thank you, and we're happy to take any questions you may have.
Thank you, Christine. Sally, let me go in order. Is that okay? Yes. Let me go around to make sure that everybody. Okay. Jose, do you have any questions?
No questions. Thank you.
Thank you. Dr. Katz?
No questions, thank you.
Thank you. Frida?
No questions, thank you.
Sally?
Thank you. Would it be safe to say that that the demand for dialysis treatment is such that we could do more in our hospital system than we currently do?
I think with the term agreement that we have now, it gives us 5 years to really look and really strategically think how we can start bringing these services in-house.
Because I don't know, Christine, if that's an area of investment for under the capital plan, or is strategically
Sure.
in the
So
system, are we?
yeah, so there are a number of projects that have been identified from a strategic perspective of enabling the space for dialysis to occur. We are working towards securing the CONs for the rest of the post-acute locations. One of our other Queens hospitals is interested in expanding their dialysis capabilities as well. And we did work very closely with Milton at the time and the council around nephrology and the needs from an inpatient perspective as well. There was actually a lot of emergency work done to increase and expand our inpatient dialysis capabilities bedside, as well as looking at outpatient services. So it is definitely an area, a clinical area that has been identified by a number of our systems leaders. where they don't, in cases where they don't feel like they have adequate around the demand. You know, Harlem Hospital has a fairly large dialysis outpatient capability, so it does vary per site, but it definitely is one of the service areas that I think each of our facility leaders looks at closely with their clinical leadership teams.
Thank you so much.
Any other questions, Sally?
That was it. You want me to make up some more questions?
No, 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 no. I
No,
just thank you. I just want to say that thank you, Helen, and thank you, your team, as well as Christine and her team, and Jeremy, for what you are doing in this particular agreement. You know, as Helen has mentioned, the doctor supporting this is really very much in line with the goals and the kind of the values of the institution, both in Amherst as well as Health and Hospital. And so it's good to be able to make sure that we all work together and make it happen. So I just want to thank all of you for working so diligently and ensuring that we are all aligned. So that was my only comment. I didn't have any questions. So if there are no other questions, I would like to ask each one of the members of the committee to vote on the motion being put forward. So I will ask Jose,
Yes.
Dr. Katz,
Yes.
Frida,
Yes.
Sally,
Yes,
and I also vote yes. So the motion is carried. So thank you, both Helen and everybody. And then there is no other motion. Is that correct?
That's correct.
So I just want to find out if there is any old business that we should be discussing. Any new business? If there are no further discussion, meeting is adjourned. You see?
oh,
Good
wow.
job, Benny.
Wow. Oh,
Christine, we expect more from you usually.
Yeah, 36 minutes to spare, Benny. Good job.
I'm giving everybody an early gift for the holidays. 36
Thank
minutes.
you.
See you, everyone.
Nice to see you,
Bye.
Helen.
See
Everyone.
you. Bye-bye.
Bye-bye. Be well.
Bye.
Bye.
You know, there's a bit of old business